we're going to start seeing more boys who are puberty blocked at Tanner stage 2, like basically as soon as their testosterone first spiked, as soon as their testosterone first spiked, and now they look very much like girls, and they're going to be going into, God forbid, one of them experiences some complication, and they show up in an emergency room unconscious, and the doctor thinks that they are trying to dose a female with anesthesia, or that they're looking for heart attack symptoms in a female, because this person looks like a female, and this person can't advocate for themselves, but really this person is male. Imagine how many lives we're going to lose. Or women who are on testosterone, who look very much like men, and they show up pregnant. Maybe they're in the early stages of pregnancy, maybe in the later stages of pregnancy, but they look so much like men that if they show up unconscious in an emergency room, who is going to screen them for pregnancy? So then the baby can die, and then that mother could die as well. I mean, everything about this techno-medical labyrinth that we call gender-affirming care is dangerous. And it compromises the integrity of the body, the integrity of the psyche, health on an individual level and on a public level. And there are going to be so many things that we as a society, we've gotten ourselves into this mess. We've opened Pandora's box. We need to have a very sober, very thought out understanding of how did we get ourselves into this mess? How are we going to, get ourselves out? How are we going to tie up all these loose ends? How are we going to deal with the complex nature of problems that have befallen our society now that we've allowed this to happen? And how can we ensure that all this damage that was done to a generation of young people at least didn't happen in vain? How can we learn from this experience and ensure that it never, ever, ever happens again?